Hey everyone, and welcome to Health and Alerts. I'm so glad you're here. Today, we're diving into reproductive health. Empowering you with knowledge helps you make informed decisions. We'll explore common reproductive problems and break down complex medical jargon. Remember, this video is for informational purposes only. Always consult with your doctor for any concerns. Let's talk about something that's often whispered about, but rarely discussed openly. Female sexual dysfunction. It's more common than you might think. We're talking about things like painful sex, lack of interest in sex, or even just unsatisfying sex. But the good news is, you don't have to suffer in silence. Talk to your healthcare provider. Next up, we have endometriosis. It's when tissue similar to your uterine lining grows outside the uterus. This can be painful and affect fertility. Women with endometriosis often struggle with conception. But don't worry, there are options. Surgery and IVF can help increase your chances of a healthy pregnancy. Knowledge is power. Understand endometriosis to take control of your health. Now, let's address the elephant in the room. Cancer, specifically cervical cancer, often caused by the human papillomavirus, or HPV. Regular pap smears can catch it early, improving treatment outcomes. Some treatments can impact fertility. Discuss your options with your doctor. There are ways to treat cancer while preserving motherhood dreams. Chapter 4. HIV. Living with HIV is no longer a death sentence. It can often be managed like a chronic condition. Many people with HIV live long, healthy lives. Becoming a parent while living with HIV is possible. With careful management, the risk of transmitting the virus to your baby is very low. Chapter 5. Polycystic ovary syndrome, or PCOS. Now, let's talk about a condition that affects a significant number of women. Polycystic ovary syndrome, or PCOS. Many women don't realize they have it until they start trying to conceive. PCOS is all about a hormone imbalance that messes with ovulation. This can lead to cysts on the ovaries, irregular periods, and even excess body or facial hair. But the good news is that PCOS is manageable. Talk to your doctor about ways to regulate your hormones, improve your chances of getting pregnant, and ensure a healthy pregnancy journey. Chapter 6. Primary ovarian insufficiency, or POI. If you're under 40 and your ovaries aren't working as they should, this might be the culprit. POI can cause your periods to become irregular or even stop altogether. POI can lead to hot flashes, mood swings, and painful intercourse. While POI can make conceiving challenging, it doesn't rule out motherhood. Talk to your doctor about your options. You're not alone in this journey. Chapter 7. Uterine fibroids. Uterine fibroids sound scary, but they're actually quite common and often benign. These are non-cancerous growths in the uterus. The good news is that most of the time, they don't cause any symptoms and won't affect your ability to get pregnant. However, in some cases, fibroids can increase the risk of infertility, miscarriage, or other complications during pregnancy. So, if you're planning to have children, it's worth having a conversation with your doctor about whether your fibroids need to be addressed. Interstitial cystitis, or IC, is a bladder condition that can really put a damper on your life, let alone your sex life. The frequent urge to pee, the pelvic pain, and the pressure. It's no walk in the park. And while IC itself won't prevent pregnancy, it can definitely impact your desire to have sex. But don't despair. If you're trying to conceive and your libido is taking a hit because of IC, talk to your doctor. There are ways to manage the symptoms and make sex more enjoyable, increasing your chances of getting pregnant. Now, let's talk about weight. Carrying extra weight can increase the risk of various health problems, and yes, that includes reproductive health. Being overweight can make it harder to conceive, increase the chance of miscarriage, and lead to other pregnancy complications. But here's the empowering part. Even a small amount of weight loss can make a world of difference. Talk to your doctor about achieving a healthy weight for you, and remember, it's about progress, not perfection. On the flip side, being underweight can also throw a wrench in your reproductive plans. If you're not at a healthy weight, your body might not be able to support a healthy pregnancy. Your periods might become irregular or even stop, and conceiving can become a challenge. So, if you're struggling to gain weight, it's essential to talk to your doctor or a registered dietitian. They can help you create a healthy eating plan to nourish your body and prepare it for pregnancy. Let's be honest, talking about sexually transmitted infections can be a bit awkward, but it's crucial for protecting your reproductive health. Gonorrhea and chlamydia are two common STIs that, if left untreated, can lead to something called pelvic inflammatory disease, or PID. And PID can cause some serious issues, including infertility, blocked fallopian tubes, and even ectopic pregnancy, which is a pregnancy that occurs outside of the uterus. The good news is that both gonorrhea and chlamydia are treatable, especially when caught early. Chapter 12. Environmental harms. We often think about what we eat and drink, but what about the air we breathe? Believe it or not, environmental factors can also impact our fertility. Exposure to certain pollutants, like phthalates found in plastics, dioxins from industrial processes, and pesticides, has been linked to reproductive issues. Now, it's impossible to avoid all environmental toxins, but being mindful of your exposure can make a difference. Choose natural cleaning and personal care products whenever possible, and eat organic fruits and vegetables when you can. Chapter 13. Getting older. Let's talk about the elephant in the room again. Age. As we get older, our fertility naturally declines. It's a biological reality. But here's the thing. Age is just a number, and it doesn't tell your whole story. While it's true that conceiving in your late 30s or 40s can be more challenging, it's definitely not impossible. If you're concerned about your age and fertility, talk to your doctor. There are options available, and they can help you explore those. Chapter 14. Lifestyle choices. Let's talk about lifestyle choices. Daily habits impact our health, including reproductive health. Smoking, excessive alcohol, stress, poor diet, and intense exercise can affect hormones and fertility. The good news? These are controllable. Quit smoking, reduce alcohol, manage stress, eat well, and exercise moderately to boost fertility and pregnancy health. Small changes lead to big results. That was a lot of information, but I hope you found it helpful. Remember, knowledge is power when it comes to your reproductive health. Take good care of yourself, and don't hesitate to reach out to your doctor with any questions or concerns you might have. Remember, you are your own best advocate. Until next time, this is Health and Alerts, reminding you to reset your health, reset your life. Don't forget to subscribe to the channel and share this video with anyone who might find it helpful. Let's spread the knowledge and empower each other on our health journeys.